stimulates cellular renewal, stimulates collagen synthesis. It has the immunomodulatory, neuroprotective, anti-catabolic, and anti-apoptosis properties. The local injection technique, Teqs, involves the identification of the specific landmarks, imaging study, whether it's MRI or ultrasound or X-ray, whatever is necessary and sufficient for adequate assessment of the problem that every person has, plus the clinical and physical examination, because very often chronic pain is defined or caused by the chronic inflammation in the nerves, with or without nerve impingement in that particular area. That's why the intra-articular and peri-articular injections may not be sufficient for a complete reduction or elimination of the symptoms. So on this screen you can see an illustration of such holistic approach when for one of the patients, this is a professional athlete who has a severe osteoarthritis of the right humerus bone, together with the severe rotator cuff syndrome, treated systemically by the stem cells and exosomes, plus the surgery. The patient actually went through the arthroscopy, and in a post-operative period, 8 weeks of systemic and local treatment with biologicals, with stem cells and exosomes. And you see the infiltration with the exosomes in the early post-operative period of the affected area. Another patient, the ACL test with a meniscus injury on the background of the advanced osteoarthritis. Both knees have been treated with intra-articular and peri-articular administration, and now you can see ongoing perineural infiltration therapy with placental growth factors, nanomized placental growth factors, and exosomes. You see that specific areas where we put the injection, where we place the needle, have been already identified, and the needles have been inserted there, and just I'm changing the syringe with different biological agents to infiltrate those anatomical areas around the knee joint. It's another case of a very combined injury of knee joint and ankles, with the meniscus tear and with the ACL tear and with the chronic osteoarthritis. And you can see the actual treatment protocol. 3 sessions with at least 2 weeks in between, using the potentiated local anesthesia, potentiated with a short-acting corticosteroids. It's optional, with the adding of the sodium bicarbonate to make the microenvironment in the tissue alkaline, less acidic, so that will further promote healing and will reduce the inflammation and pain. Nanomized peptides of the synovia, nanomized peptides of placenta, and Dmytro organelles placenta, 4 vials, so in total 10 milliliters, are administered peri-articularly. On the second session, again, after the local anesthesia with the alkalizer and a potentiation, intra-articular administration up to 10 IUs of the ultra-human growth hormone with the BPC 157, around 500 to 600 microgram intra and or peri-articular, and nanopeptides and Dmytro organelles placenta and cartilage, up to 8 to 10 vials on distributed equally peri-articularly around the treated joints. And the third treatment session, again, local anesthetic with the alkalizer, and this time we use exosomes, intra-articular, just 5 milliliters per joint, and peri-articular infiltration and perineural infiltration with nanomized and mitochondrial peptides of placenta and cartilage, again roughly around 8 to 10 vials for the whole treatment.